Ovarian cancer is arguably the 8th most common cancer globally, and 5th among cancer-related deaths in women in the US. Studies show that the risk of ovarian cancer increases with age, especially in women who never got pregnant, ones who had their first child above the age of 35, and especially the women above age of 50. Other potential causes are consistent and prolonged irregularities in hormones and periods, obesity, genetic mutations, and sometimes even long-term use of hormone therapies. Ovarian cancer is sometimes called the silent killer. That's mainly because its subtle symptoms make it hard to catch early and often show up in advanced stages. But the good thing is that if ovarian cancer is caught early, the chances of successful treatment are much higher. So, in today's episode, we'll tell you about the 8 signs of ovarian cancer that every woman should be aware of. Without any further delay, let's begin. Number 1. Changes in appetite. This sign of ovarian cancer can show up in 2 ways. For example, you might notice a loss of appetite, where you don't feel as hungry as you used to. On the other hand, you may want to eat more than usual and have an increased appetite. These changes can happen because ovarian cancer can affect your body's growth and hunger hormones, such as leptin and ghrelin. Leptin is mainly responsible for making you feel full while you eat, while ghrelin is the one that makes you feel hungry. This disturbance and imbalance in hunger hormones can cause your appetite to change dramatically. Additionally, the growing tumor can also put pressure on the abdomen, leading to feelings of fullness, bloating, and abdominal discomfort, which too can affect your desire to eat normally. But remember that changes in appetite don't automatically mean you've got ovarian cancer. There could be other factors at play too. And that's why it's super important to consult a healthcare professional if you notice any unusual shifts in your eating habits. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Bloating. Abdominal bloating is when your stomach feels full, tight, and swollen. Bloating can happen due to many reasons, such as overeating, gas, or indigestion. However, when it comes to ovarian cancer, persistent and unexplained bloating can be a warning sign to which you should pay attention. The key factor here is persistence. If you're experiencing bloating that doesn't go away after a few weeks and shows up with other symptoms like pelvic pain, difficulty eating, feeling full quickly, and others, then you must consult a doctor to identify the underlying cause. Bloating can show up as a symptom of ovarian cancer when tumors in the ovaries grow large enough to put pressure on surrounding organs, including your intestines, causing the belly to look swollen and full. So if you notice that it's happening to you, then don't wait for the symptoms to grow worse and get yourself checked. Number 3. Menstrual changes. The link between menstrual changes and ovarian cancer lies in the hormonal balance that regulates a woman's menstrual cycle. The ovaries play an important role in this process by releasing hormones like estrogen and progesterone. These hormones control the release of an egg from the ovaries and the thickening of the uterine lining in preparation for pregnancy. Plus, they also regulate the growth and shedding of the uterine lining during each menstrual cycle. So when ovarian cancer develops, it can seriously disturb the delicate balance of hormones. As a result, you might experience irregularities in your menstrual cycle. You might notice that your periods have become shorter or longer than usual, or that the menstrual flow is heavier or lighter than what you're used to. Some women may even start skipping periods altogether due to the hormonal disruption caused by the cancerous growth in the ovaries. Number 4. Frequent urination. In the case of ovarian cancer, the spreading of the cancerous cells in the ovaries can put pressure on the bladder or nearby organs. This pressure can irritate the bladder and cause the feeling of need to urinate frequently, even if your bladder isn't full. It's not always easy to connect frequent urination with ovarian cancer. Sometimes you might think it's just due to drinking more fluids or other less serious reasons. However, if you need to use the restroom more often than usual, and this change persists over time, you should consult a doctor as soon as possible. Number 5. Pelvic pain. The pelvic region includes the reproductive organs like the uterus, fallopian tubes, and ovaries, as well as other nearby structures like the bladder and intestines. So anything unusual going on in that area can cause pain. The ovaries are located deep within the pelvic area. Ovarian cancer often begins in the cells that line the ovaries, As the cancer grows, it can cause the ovaries to become enlarged and put pressure on the surrounding tissues. This pressure can lead to sensations of pain and discomfort in the pelvic region. Number 6. Unexplained weight loss. Cancer cells can alter the way your body processes nutrients, which can lead to weight loss. In the case of ovarian cancer, the tumor can cause changes in your metabolism that can affect your body's ability to absorb nutrients properly, leading to weight loss without any conscious effort on your part. This can happen when ovarian cancer cells release certain compounds called cytokines that can affect your body's normal functioning. These substances can lead to changes in metabolism, appetite suppression, and even inflammation, all of which can contribute to weight loss. And as I said before, the tumor can put pressure on your digestive organs, causing discomfort and affecting your eating habits. This too can cause unintentional weight loss and will be clearly noticeable. So do not ignore this sign of ovarian cancer and get yourself checked as soon as possible. Number 7. Fatigue. When it comes to ovarian cancer and fatigue, there's a clear connection rooted in how your body responds to the disease. Ovarian cancer cells grow and multiply rapidly, and this process demands a lot of energy from the body. So your body has to use a significant amount of its energy to deal with these rapidly dividing cells. Also, your immune system steps up its game to fight off the cancer, but this increased activity requires more energy too. Furthermore, ovarian cancer can also cause symptoms of anemia, mainly by reducing your body's ability to utilize iron for the production of hemoglobin for your red blood cells. So when your body lacks red blood cells or hemoglobin, it won't have enough oxygen to transport to your body, causing feelings of fatigue and weakness. Number 8. Swelling in legs. Leg swelling, also known as peripheral edema, occurs when excess fluid gathers in the tissues of the legs, causing them to become swollen and puffy. When it comes to ovarian cancer, leg swelling can happen due to a phenomenon known as ascites. When ovarian cancer cells spread to the peritoneal cavity, the gap between your abdomen and organs within it, it can cause a fluid buildup there. This condition is known as ascites, and it can press on the blood vessels in the pelvis and lower limbs, leading to leg swelling. Additionally, ovarian cancer can also cause a condition called deep vein thrombosis. DVT is a blood clot that forms in a deep vein, typically in the legs. When a blood clot blocks the blood flow in the veins, it can cause swelling in your legs due to fluid retention. Ovarian cancer can also trigger the release of certain proteins called clotting factors that increase the risk of blood clot formation, leading to leg swelling. So if you notice any of these signs and symptoms of ovarian cancer, do not ignore them and contact your health expert before it's too late. They can help determine the actual cause of your symptoms and guide you on the best course of action. Remember, addressing these signs early can make a big difference in your health journey. Thank you for watching and subscribing to the channel. See you in the next video.